Hello everyone, today I will be explaining to you the femoral triangle. So the femoral triangle is nothing but a triangular depression which is located in the front of the upper one-third of the thigh. So now let us discuss its boundaries. So this is the femoral triangle. This is the base of the triangle and this will be its apex. So the medial border is formed by the medial border of the adductor longus muscle, while laterally this triangle is bounded by the medial border of the sartorius. So remember that medial border of the both muscles is involved. Now let us discuss the roof. So the roof of this triangle is formed by skin, then superficial fascia. So in superficial fascia you will find superficial branches of femoral artery and corresponding veins. In the deep fascia we will see the cribriform fascia which surrounds the saphenous opening. The floor of this triangle is formed by 4 muscles. As this is the lateral side, so laterally it is formed by iliacus and tendon of psoas major, and medially it is formed by 2 muscles, pectineus and adductor longus. Now let us look at the contents of the femoral triangle. So now, as the name suggests, femoral. Therefore, we have to write 3 things, which is the femoral artery, femoral vein and femoral nerve. Let us look at it in a bit detail. So, femoral artery, it enters by traversing the inguinal ligament at mid-inguinal point and it continues till the apex. So, now the femoral artery gives 6 branches, 3 superficial and 3 deep. Then we have the femoral vein which lies medial to the artery. So this is the medial side and this is the lateral side. So we can see that the vein is lying medial to the artery. So near the base, the vein is lying medially, but at the apex, its relation is posteromedial to the artery. Okay. So our next content is the femoral nerve. The femoral nerve lies lateral to the artery. We can see here that it is lying lateral to the artery. So we have a branch of the femoral nerve which is nerve to pectineus. This is also one of the content. Then we have lateral cutaneous nerve of the thigh. This is also visible here. We also have a femoral branch of genitofemoral nerve. This occupies the lateral compartment of the femoral sheath. Then the femoral triangle also consists of deep inguinal lymph nodes. So the deep inguinal lymph nodes drain superficial inguinal lymph nodes and it also drains glans penis in males and clitoris in females. The 7th content is the femoral sheath. So now the femoral sheath is nothing but a funnel shaped sleeve of fascia. So the femoral sheath basically encloses the upper 4 cm of the femoral vessels. So it is kind of lying here. Sorry. Yes. So now I will explain to you the femoral sheath in a bit detail. So what is the definition of the femoral sheath? It is nothing but a funnel shaped sleeve of fascia. So now the femoral sheath, how is it formed? So basically it consists of an anterior wall and a posterior wall. So the anterior wall is formed by continuation of the fascia of the abdomen, which is fascia transversalis, while the posterior wall is formed by fascia iliaca. Fascia iliaca is nothing but the fascia which covers the iliacus muscle. Okay. So now what happens to this sheath inferiorly? It gets fused with the connective tissue around the vessels. So now this femoral sheath consists of 3 compartments which are formed by 2 septa. Okay, so these are the 3 compartments. This will be the lateral part, this will be the medial side. So this is the lateral compartment, this one is the medial compartment, and in the middle we have the intermediate compartment. So now let us look at the contents of each compartment. First is the lateral compartment. So the lateral compartment consists of the femoral artery. A nerve is also observed here, which is the femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. In the intermediate compartment, we have the femoral vein. This is the intermediate compartment whose content is the femoral vein. In the medial compartment, we only have lymph nodes, which are called as lymph node of Cloquet or Rosenmüller. Okay, so and this medial compartment is also called as the femoral canal. I will explain this to you in a bit. Now, one important point to note is that the femoral nerve does not lie in the femoral sheath, rather it lies outside the femoral sheath, lateral to the femoral artery. This can be asked as an MCQ, as if which content of the femoral triangle does not come inside the femoral sheath. So the answer will be the femoral nerve. Now let us look at the femoral canal. Femoral canal has its very high clinical importance. So femoral canal is nothing but the medial compartment of the femoral sheath. So it is conical in shape. So just imagine as if this is your femoral canal. So now as you see that it is conical in shape, right? Therefore it has an apex and it also has a base. So now as the base is more wider, it forms a ring, and this ring is called as the femoral ring. Now let us look at the boundaries of the femoral ring. So anteriorly it is bounded by the inguinal ligament. Posteriorly we have the pectineus muscle and its covering fascia. Okay. Now let us consider this the medial side and this the lateral side. So medially we have the lacunar ligament, and laterally we are going to have this septum. Okay. So now what is the content of the femoral canal? It consists of lymph node of Cloquet or Rosenmuller along with few areolar tissue. This was all about the femoral triangle. In case of a question such as you might get an SAQ or you might get an LAQ, so you have to write in the same manner. First you have to write the definition, then you have to describe the boundaries, roof and the floor. You should draw these two diagrams because diagrams are really important when it comes to anatomy. Then you have to mention the contents. You have to describe, at least write 2 lines about each content. Then you have to explain the femoral sheath. You have to draw a well-labeled diagram showing all the 3 compartments and its content. Then you have to describe what is the femoral canal. Once you have described the femoral canal, you have to move on to its clinical aspect. So I will discuss the clinical aspect of this femoral canal in the next video. So this was all for today. Thank you.